Hi, I'm Dan Hart from Infectious Disease, and I will be speaking about vaccinations. The three vaccinations that SMG is being held accountable for by our insurance contracts are influenza, pneumococcal, and human papillomavirus. As you can see by the slide, our vaccination rates are approximately 50% or less for these three types of immunizations. The optimal goal is 75%, so we have a lot of work to do. Let's start with influenza. As most of you will recall, the 2017-18 flu season was one of the worst in recent years. There were more than 80,000 deaths, with the majority of those in patients 65 years and older. However, there were also 180 children and adolescent deaths. The vaccine is indicated for everyone aged 6 months and older. One dose per season is sufficient, with the exception of children 6 months to 8 years of age without 2 prior doses. These pediatric patients can be given 2 doses separated by 4 weeks. There is also a high-dose influenza vaccination that can be considered in those 65 years of age or older. At SMG, we use Fluarix and Fluzone. Fluarix is a quadrivalent vaccine, which means that it has 2 A strains and 2 B strains. Fluzone comes in standard dose, which is quadrivalent, and high dose, which has 1 B strain. All of the above contain formaldehyde. None have thimerosal or latex, so patients with these allergies can safely receive the influenza vaccination. The main side effects are injection site reactions, fever, and muscle aches. Only those with severe egg allergy, such as anaphylaxis or angioedema, should avoid the vaccine. Those who have had Guillain-Barré syndrome within 6 weeks of prior influenza vaccination can also defer. For those who are pregnant, vaccinate. This population is at higher risk of complications. Please note that there are no compatibility issues between influenza vaccination and other vaccines. In fact, it's also okay to give it with pneumococcal vaccination. Speaking of pneumococcal vaccinations, these should be given for everyone over age 65. Prevnar 13 can be given first, followed by Pneumovax 1 year later. If Pneumovax was already given, then Prevnar 13 can be given 1 year later. Boosters are not needed for patients who have received one of each over the age of 65. Pneumococcal vaccination is also indicated for those aged 19 to 64 with immunodeficiencies, anatomical or functional asplenia, chronic renal failure or nephrotic syndrome, as well as those with CSF leaks or cochlear implants. In this patient population, Prevnar 13 should be given first, followed by Pneumovax 8 weeks later. Patients should receive 1 booster of Pneumovax 5 years later, except for those with CSF leaks and cochlear implants. Only Pneumovax, not Prevnar, should be given for those aged 19 to 64 who are immunocompetent but have chronic heart disease, chronic lung disease, chronic liver disease, diabetes, are cigarette smokers, or are residents of long-term care facilities. Both pneumococcal vaccines are thimerosal and latex-free. The vaccines are most commonly associated with injection site reactions, fever, and headaches. The vaccine should be avoided if there was a prior anaphylactic reaction. In terms of pregnancy, there is limited data, but it's assumed to be safe. It should be given in high-risk patients. In terms of compatibility, it can be given with other immunizations, especially influenza. One exception is Menactra, where it should be separated by 4 weeks. The last vaccination to discuss is HPV. The human papillomavirus is the most common sexually transmitted disease in the US. It causes both benign warts and multiple cancers. It is indicated for all females aged 9 to 26 and all males aged 9 to 21. It can also be given to males aged 22 to 26 who are immunocompromised or having sex with other males. Anyone with HIV aged 9 to 26 and any children aged 9 or greater with a history of sexual abuse should also be given the vaccination. Of note, the FDA approved use of the vaccine in people up to the age of 45. Guidelines have not been updated to reflect this as of yet. Gardasil 9 is the human papillomavirus vaccination. It does not contain thimerosal or latex. Side effects are similar to the other vaccinations. It's contraindicated in anyone with an anaphylactic reaction to a previous dose or a vaccine constituent. It is not recommended in pregnancy due to limited data. However, there is no need to test for pregnancy before administration. If a woman becomes pregnant, the series can be completed after pregnancy. There are no compatibility issues. For those who are aged 9 to 14, 2 doses are given, with the second at 6 to 12 months after the first. For those who are age 15 or greater or are immunocompromised, 3 doses are given, the second at 1 to 2 months and the third at 6 months. If a dose is missed, there's no need to restart the series, just resume with the next dose. This concludes the vaccination presentation. Thank you for your attention.